full mouth reconstruction is done, we call it full mouth reconstruction. That can be a whole bunch of things. Implants, bridges, braces, all kinds of things, but it's bringing the mouth to full function again and full beauty. So most people need a full mouth reconstruction because they've just worn their teeth out. So let's say a person has all their teeth, but they have ground them down to nubs. They've changed color, the gums are moving away from the teeth, and the teeth are jagged. Their teeth could hurt them, but sometimes they don't even hurt them because they just work them so hard they don't even know. So much of the tooth structure is damaged that is no longer functioning correctly, and what happens is that damage is now going to cause the loss of the teeth. If they continue to go with this damaged teeth without correction, then those teeth are going to be lost. Whether they're lost next week and they start breaking or they're lost in 3 years, they're eventually going to be lost. What we see all the time is people delay their treatment, and then all of a sudden they come in and their one tooth is in pain, just one, but that tooth broke right down the middle. There's nothing I can do about it. It has to go. Now they need an implant, right? And so now that implant is at risk because they haven't fixed the grinding problem and the pressure they're putting on the teeth. So you just spent thousands and thousands of dollars to replace this tooth that needed to be replaced, and it could be lost too because you're not fixing the whole thing. You have to fix the whole mouth in order to prevent the future damage of all the teeth. If you just fix one tooth here and one tooth there, that's fine, you can totally do that. But the reason why you broke that tooth, you didn't correct. And the reason why you broke that tooth is the grinding and the wear. And so with a full mouth reconstruction, we have the ability to put the teeth back to a position where you're no longer grinding the teeth. We find the place where these muscles are most relaxed and don't want to grind anymore. So we put the teeth into that position where these muscles are most relaxed, and then we build the bite back to that position. And once you have that position correct, then those teeth last a long time. That's what we do. We rebuild that bite. Now, some people have symptoms, and some people don't have any symptoms at all. So some people have ground their teeth down to nubs. They are aware that their teeth don't look quite as nice as they used to, but they don't have any problems. And then some people have a lot of symptoms, and the kind of symptoms that people get when they're grinding their teeth and their muscles aren't in the correct balance, so they're grinding their teeth and things aren't quite right, and they're doing a lot of damage to those teeth, is they'll start to get headaches. They'll get muscle aches. Their jaw joints will start to make noise, and they'll hear it in their ears. They'll hear this crackling and popping noise, and they think it's normal, but it causes pain. If it causes pain and any noise that you hear, it's not normal. You need to see the dentist and you need to get treatment. And the kind of treatment that you need when you have those kinds of problems that have symptoms is you need a full mouth reconstruction, which means that we put your jaw in the corrected position so that these muscles don't hurt anymore. We use a splint appliance to find that position. Now we build your bite back to that position.